Hey, welcome back everyone to the Progressive Brothers Podcast. This is episode 84. Please hit the like button as you come in, share the video if possible, and hit that notification bell in order to get alerts from the Progressive Brothers Podcast. Also, make sure you follow us on Twitter at brothers_podcast. I'm here with my guest today, Dr. Phoenix. Welcome, Dr. Phoenix.
Hi, how are you doing?
Good. So today's topic is Black men and cancer awareness. And so we know that this month is Breast Cancer Awareness Month, but why is cancer awareness important for Black men at this point?
Yeah, so I'll just start off with a little bit of my background. So I first got involved, my personal experience with cancer, that my grandfather had prostate cancer. He eventually passed away from it. So I was very young at the time, and didn't really think much of it, other than the fact that by the time I had found out, he had it for a number of years and had gone through therapy and had been treated for it, but eventually got to the point where the cancer began to spread and eventually took his life. And so it was only when I went to undergrad for nursing, and I got involved in research as a McNair scholar, and I started in the area of diabetes and diabetic retinopathy. But then, because again, cancer is a chronic disease, it is kind of difficult. Was kind of virtually impossible to not talk about, not to deal with mostly with Black people, and certainly Black men, and the issue of cancer, and specifically prostate cancer, not pop up and become a major topic of conversation. And so it was through these conversations where, at the time, I was in Milwaukee, Wisconsin, and if you're not familiar with this, Mike, Milwaukee, Wisconsin has some of the highest rates of GI, gastrointestinal, and prostate cancers among Black men in the country. They have some of the highest rates, and it was only when I, as a student, as an undergrad, close to my graduation, I started to get a lot of Black men that were coming to me, talking to me about this doing my research. And I'm like, okay, well, I'm dealing with diabetes and I'm dealing with diabetic retinopathy, but I got a lot of Black men coming to me about cancer. And because there's a major initiative through the Milwaukee Health Department with the Men's Health Division, with educating Black men on prostate and GI cancers. And so it just one of those things that just kind of happened at the time to fall right in my lap. And so, yeah, it was kind of eye-opening, because it made me think back to my experience when I was a kid and find out my grandpa had cancer. And again, when I found out he was terminal and he only had about 3 months to live. So actually coming up on the anniversary of his death in about at the end of December. So
That's like it.
So that's kind of my experience.
That's an interesting point that you're making, and an interesting experience that you've had. Why is it not promoted more for men than it is for women? Like, this month would be considered Breast Cancer Awareness Month, but September is considered to be
prostate
cancer awareness, but it's almost not acknowledged. Why is that?
There's a few reasons. One, there has been really this apathy among men, and it's not just something specific to Black men, but men in general. And typically because when you're dealing with genital urinary cancers, specifically genital cancers among men and women, prostate cancer tends to be more of a slow-growing cancer. So many men might have it and may not know until they've started to have symptoms and it has progressed to a point where it may not even be treatable, or it's kind of at that boundary where it's still treatable, but it may be more aggressive. And so, as to compare to where genital cancers in women tend to be very rapid. I mean, they tend to grow pretty rapidly. And so there's an immediate effect on women, but women have been far more active in their overall health and advocating for their overall health than, truth be told, than men have. And this is especially true of black men, where black men have always had these stigmas around, yeah, I have to go get a prostate exam. I don't want this physician doing a prostate exam on me because it may somehow interfere with my masculinity or my manhood. It may somehow make me less of a man because he had the physician had to check my prostate through my anal canal. So not to be really graphic here, but the point is that there's been a lot of hesitation among black men specifically because of the very stigma of getting a prostate exam. However, there's just one way of assessing the health of the prostate. So you have something called PSA testing, prostate-specific antigen testing. And so this is a blood-based test. Basically, they draw some blood and they can check your PSA through your blood. And that's not quite as invasive as having a digital rectal exam for your prostate. And so, but the part of the reason this became an issue for me is because the men that I was seeing were in their early 40s and 30s. Many of these men were in their early to mid 30s, late 30s, and early to mid 40s. So far younger than what many men typically present with prostate issues or even prostate cancer for that. So
yeah, and interesting. So what is the typical age range that you start to, I guess, maybe get a cancer screening?
So typically it's around 45 years of age as dictated by the CDC, but in my general experience, because I started to go into this area of research again in undergrad through necessity, because I had a lot of black men coming to me with these issues. They had the issue, or they knew someone close to them that had the issue, or whatever the case may have been. And I started to look into sort of the guidelines for to get testing, and because many of the men were under 45 years of age that I was seeing, I would personally recommend to black men that I talked to at the time, even now, I would personally recommend black men to start getting PSA testing in your mid-30s, just simply because the rates of younger black men who have been presenting with cases of prostate cancer have certainly increased quite dramatically over the past decade or so.
Now, is there a challenge to this in terms of insurance versus not having insurance, cost versus, I guess, charity-based initiatives? Where's the challenge here?
I mean, it can be somewhat of a challenge, but I will say this. Depending on, most men work. Most men have work jobs that provide some level of health insurance. The major problem is not really the health insurance. The major problem is convincing black men to go. It's not that black men necessarily don't have the ability to afford it. Is that, do they have a medical home? Do they have in other words, do they have a primary care provider? This is the realm of what your primary care provider should be doing. They should be assessing you, and they should be checking you on a regular. They assuming that they're knowledgeable on the population that they're dealing with. Are they taking into account the risk factors that various populations might present with? Again, there's a lot of genetic issues that make black men more likely to develop cancer. I ain't gonna say more likely. I would say at a higher risk for prostate cancer. But because typically black men tend to have more aggressive forms of prostate cancer. And a lot of that is really not necessarily because they may be genetically susceptible to it, but really because they have really, because black men tend to wait until they're really having symptoms to go get seen by someone. And a lot of times, and at that point, in many cases, is usually the cancer may have progressed, it may have become more aggressive, and because prostate cancer tends to be a very slow growing cancer, the problem is that once it begins to spread, once it begins to metastasize, it becomes virtually untreatable. But if you catch it in its early stages, there's a pretty high effective cure rate. So you're looking at cure rates around 80 to 90% if it's caught early. So and it's not really I wouldn't say the major issue, at least in my experience, has been really men having health insurance, because even in Milwaukee, there's a number of federally qualified health centers you can go to that, if you don't have insurance, they do this for free. You can get seen by a primary care provider. You can potentially have them as a medical home, and they will facilitate you having those assessments, being assessed for your risk of prostate cancer. And certainly a lot of it has really to do around the stigma, and not just the stigma of getting a prostate exam, but really being proactive in managing your healthcare. And I think a lot of many black men that I've met over the years have not been as forthcoming about their own risk factors for prostate cancer or cancers in general, and many other diseases. So whether it can be hypertension, it can be cardiovascular disease, it could be GI cancers, in particular intestinal cancers, which are another major cancer among black men, GI cancers. So I mean, these are all issues that are very that are affecting black men, certainly at a disproportionately higher rate compared to other men. Because one thing to keep in mind is that black men are between 3 to 6 times more likely to die from prostate cancer compared to any other group of men. Now, when you look at risk factors, it kind of goes sort of in I don't want to say a hierarchy, but it's more or less, you have black men, specifically black men of African and Caribbean descent, tend to have the highest risk factors. Then American black men, then you have white men, then you have Indian, Asian men that's kind of tend to have the lowest risk factors.
That's a very interesting perspective. How much does nutrition play a role in?
The nutrition plays a very heavy role, and so I want to be clear by saying that nutrition is not the one-all factor, but it plays a very significant role. It doesn't necessarily mean that, okay, well, yeah, I ate I lead a very healthy lifestyle, I eat all the right foods, that I'm perfect, I'm invincible, I'm not gonna get this. No, many men develop prostate cancer even as very healthy men. Remember, keep in mind, lots of men in their 30s tend to develop testicular cancer, which that's a very common cancer for men in their late 20s, early 30s. You have folks like, probably not the best example, but like folks like Lance Armstrong, who had testicular cancer, come from a number of things. But the point is that here's a man who's seemingly very healthy, athlete. You see a lot of athletes develop cancers. It's not uncommon. These are people who are considered at the pinnacle of peak physical perfection, but yet many of them have these epigenetic factors that make them predisposed to development of cancers, and black men are no different.
Now, saying all that, in that we're in a pandemic, COVID plus cancer. We saw recently General Colin Powell pass away from COVID complications, and on top of the fact that he was battling a certain type of cancer. what do you say to something like that?
Yeah, and so I guess people, I've been reading up on that, and people have been certainly using his example as a reason as to why, for example, vaccines may not be very effective, and 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 truth be told, while that does not look favorably upon vaccinations, however, and we're just using vaccinations as an example here because I know his death has been something that's really been a sticking point for anti-vaxxers who don't want to get a vaccination to say, well, look, he had the vaccine, but he was healthy. But people need to understand something. One, Colin Powell was a man of advanced age. He was 84 years old. If we weren't dealing with COVID-19, Colin Powell would have most likely succumbed. It sounds like he had some form of a blood cancer, from what I understand. And so again, given the effects of what COVID does in the blood, for example, the cytokine storm that it creates within the body, which causes massive levels of inflammation. So he's already in an immunocompromised position, regardless of whether he had the vaccine or not, because he has cancer. Let's just make this, try to put this as clearly as I can. When your body is fighting cancer or fighting any virus or disease for that matter, your body has to devote significant amounts of resources to fighting off that one disease. So the more difficult the ailment is, the more resources the body needs to devote to that. And then you have something, he's already in an immunocompromised position as cancer. This is why all the theories people tell you about all of the arguments people are saying about innate immunity. Yeah, innate immunity is a big caveat. You might as well put a very big asterisk by that, because there's a number of things that can affect your ability of your body to effectively fight off any condition, whether it's cancer or COVID, for that matter. And so with the case with Colin Powell, it can be argued that COVID is more, as much as people relate it to a respiratory illness, it can very much be considered a blood illness as well, because of just the havoc that it wreaks on the blood system, specifically the clotting process, how the cascade of clotting factors in the body, how that gets affected when you're infected by COVID. And that cytokine storm raises the likelihood of the development of clots because of those massive levels of inflammations, which ultimately affect those clotting factors within the blood. So in his case, Colin Powell, the vaccine, would I say the vaccine have helped him? Yeah, it would have helped him had he not had cancer, and he was already in an immunocompromised position. And again, keep in mind the simple fact that healthcare systems have been overburdened by treating so many people with COVID-19. We don't know whether or not his blood cancers were being effectively treated. Because remember, hospitals are still foregoing, COVID patients are still getting the priority here.
This is true. But what you say in black men in particular, African Caribbean, are more likely to be impacted by this. I wonder, what role does racism play from a stress standpoint on those who may be candidates for whatever form of cancer may be attributed to them?
Yeah, and I would be the first to tell you to say that yes, race does make a big difference in this. It makes a big difference in whether or not you're getting that preventative care, whether or not your provider may be adequately assessing you for risk factors for prostate cancer. Certainly, we all know stories of black folks, not black men, especially not getting the standard of care. And so yes, those are all factors that are all just hanging over the heads of really just are just always ever present. whenever as a black person, and this includes myself as well, when you're in the medical system, you're always wondering whether or not are you really getting the standard of care. Would this provider have done this for me had I been white? That those are all valid questions and certainly valid concerns. But what I will say is that if black men want things to truly represent something that looks like we're getting the standard of care, we're getting equitable treatment within the medical system, it's going to take more black men getting into these fields. And unfortunately, for someone like myself, it's hard to be around. It's hard to say this because, I can't sit here and be the only black man. I can't be one of a handful of black folks, and certainly one of the handfuls of black men in the medical field. Okay, I cannot have gone to nursing school, be in medical school, doing all this stuff, and literally be statistically my representation within my class, within my profession, is almost statistically insignificant. Again, black men are only about 2% of your total physicians in this country. I mean, for the most part, you're almost statistically insignificant. Black women have been able to, in the past decade, have been able to not only catch up to black men in terms of representation within the medical field, but surpass them. Their numbers now are a little bit greater, and certainly in the physician ranks, than black men, as to where 20 years ago that wasn't the case.
So, I guess you have to meet people where they are.
Absolutely.
And so does that
I totally believe in point of care. I believe that point of care is the wave of the future.
So does that mean going into the barbershops, going into the these locker rooms and things like that, these pointer areas that where there's congregation of black men, churches, barbershops, any other places you name?
Yeah, and that's the interesting part. Part of the problem is that black men need to be comfortable with other black men, because this is something this is something that I've observed over the years. Black men are not typically comfortable around other black men, and certainly speaking about issues like this around other black men. I mean, it's only when you can absolutely assure them, there's no judgment, there's no repercussions for talking about this, whatever, do black men kind of sort of open up. But the other problem is that most black men do not have a true grasp on their medical history. They don't know whether their fathers had prostate cancer. They don't know whether their grandfathers had it. Maybe a great-grandfather had it, an uncle had it, a brother. A lot of these things tend to be many of the medical issues in among black people tend to sort of be almost in this realm of mythology. It's almost as if these things are not really as well. Well, we know your grandfather died from XYZ, but we don't, they say it was this, they say it was that. No one can ever really pinpoint this. And this has been a common issue where black folks have no real grasp on their medical history. And this is not just a black male issue. No, this is a black female issue as well. Where these medical issues become really these taboo conversations, become more these conversations that are in the realm of mythology and legend. It's like an urban legend in many respects. And so it's only until we get serious about, black fathers are sitting down with their sons and telling their sons like, yes, your grandfather had prostate cancer. Yes, son, I had prostate cancer. And I want to be clear about something, because for older black men, specifically black men 60 and older, sometimes it may not necessarily be prostate cancer. It can also be another condition called benign prostatic hyperplasia, which is basically an enlargement of the prostate, which the vast majority of men are going to deal with as they age. If you get to be old enough, it's probably going to be a problem for you. That's just a common issue as men get older.
Now, what kind of person in the medical field, in the healthcare field, would have a better understanding of the history? Is it an epidemiologist?
Yes and no. Remember, epidemiologists are more like biomedical health data scientists, if you will. The person that would probably be most apt to know this would either be your physician or your nurse practitioner, your PA. Assuming that they're black, they will understand these nuances of having a black population to care for.
Now, before we close out, if you were in charge of a public health commission, what kind of steps would you implement to better remedy and address these issues amongst the male population, the black male population?
I think this needs to be a conversation facilitated by black men. Typically in this space, and certainly within the realm of public health, it tends to be a very female-dominated area for the most part. And while I don't think black men would necessarily have a problem talking to black females about this, for example, I think, however, when it really comes to those issues, especially when you're dealing with prostate cancer, you're dealing with issues of erectile dysfunction. If they have to get their prostate removed, they might be fearful that they might completely lose function, the ability to get an erection. So, black men will necessarily not be comfortable talking to a black woman about that. However, it becomes something more or less, I would start by making these conversations happen among black men. So specifically, these have to be conversations that are facilitated by older black men and younger black men. And so it has to be, we have to find black families and black men, get their families together, get the men and their families together and have them have this conversation so that younger black men can understand, yes, what are my risk factors? Because it is so common these days to see many black men who are healthy, but yet they might end up with high blood pressure. They might end up developing prostate cancer or GI cancer. And again, when my first task would be to get black men together where they can facilitate these conversations, specifically get black men from the same families together to facilitate these conversations, because this has been a major problem that I've seen over the years where most black men have no clue about their family medical history. Black women are a little bit more adept at it, but not by much. They're a bit more knowledgeable, but not by much at all. But black men, this is certainly a major problem. These things are really just shrouded in myth, and it should never be that way. Because the ability for black men to have these conversations with their sons could potentially save your son's life.
Is there a step 2, step 3 to it?
Step 2. I do think this has to be a point of care issue. So you alluded to it earlier. You have to meet people where they're at. It truly has to be a point of care. So you think about areas where black men go to. I mean, again, this has been talked about. There's a number of research programs that have developed over the past 2-3 decades that did try to do that and reflected upon that. But those programs are typically facilitated by white people. And again, it becomes more of an issue where for black folks, if you want these outcomes, for black men, if you want these outcomes, these programs have to be facilitated by you, by your own people. So my second step would be, establishing programs establishing point of care programs. So meet people where they're at. So where are places that black men frequently congregate at? I hate to use the word congregate because it kind of sounds really religious and church-like, but I would say where areas or where areas that black men will be in groups at, that you can find large numbers of black men. So obviously we all know the barbershop. And I'm not against the barbershop thing. My only thing about the barbershop is that the barbershop tends to be a place where a lot of misinformation happens. And so you have to, folks, if you're gonna have black men, if you're gonna have these kinds of programs, for example, in the barbershop, it has to be a program, and I would put a program in place where obviously this has happened in the past, but again, it has to be something that's coming from black men. It's came from everyone but black. These initiatives have come from everyone but black men. And so these programs have to be facilitated by black men. So it has to be black male medical providers coming into places like barbershops or the gym or any other place where black men would meet in large numbers at, and doing some of that on the ground at the point of care health education, being able to discuss these issues with barbers, maybe with physical trainers, and really talk about that and link the nutrition piece. Like I am a big proponent of nutrition, but nutrition is not a end all be all to what happens to anyone. There's a number of factors that goes into whether or not someone is healthy. And so yes, that would be my step 2. Step 3, and I will argue step 3, it would have to be the establishment of programs that are specific to black males and specific to their needs. Part of the reason why, the major reason in my opinion, why many black males are foregoing like college or getting into medical professions or some of these other professions. Obviously you need college degrees and college level education to get into these professions, is because many black males are just not academically ready. They're just not ready for that level of rigor. And so there has to be programs in place specifically for black men and black males in particular, young black males, that really give them that on the ground introduction into laboratory science, into medical science, and into being able at 12 or 13 years old, being able to shadow a physician or a surgeon or even PAs or NPs. I mean, I'm open for all of that. Being able to shadow laboratory scientists, see what biomedical scientists do, see what folks do that are doing these assays, doing these genetic assays. Folks that are involved in genetic testing, seeing what these scientists are doing on a daily basis. There has to be programs specifically for black males. A major part of the reason is that many black men, by the time they get exposed to these things and they even start to consider these things, many of them will have to do a complete 180 in their life to bring themselves up to speed. The point, you cannot get into this when you're already in college. This has to be something that has to be sort of bred into you throughout your younger years leading up to those college years, if that makes sense.
No, it makes complete sense. And I just wonder if there's space for opportunity to connect point of care to more clinical infrastructure at the ground level, rather than waiting to go to the ER and clog up the ER with other sort of more primary priority-based factors such as COVID and other cases. I wonder if there's a mechanism that can be built that connects point of care to the clinical infrastructure.
Yeah, and I know we're short on time here, and I try to make this really quick. Yeah, there is. And we were discussing it offline before we did this recording, and that's with telehealth, teletherapy, artificial intelligence, cloud-based infrastructure. That is going to be the cornerstone of 21st century medical care. And that teletherapy, cloud-based infrastructures. Artificial intelligence is going to give providers the ability to provide on the ground at the point of care, at the point of care services. And so people may not even have to travel 2 or 3 miles to a ER or hospital, whatever. They will be able to be seen right where they're at. You can walk a couple of blocks and you're at a facility where you can get screened for something like prostate cancer. You can get screened for high blood pressure. You can see your risk factors. You can get examined. You can get physically assessed and see what you have going on right now, because providers will be able to get those data points, put them into an algorithm. An algorithm will be able to give them a better understanding of what's going on with that patient at that moment, and they will be able to take the appropriate steps to do what's necessary to maintain that patient's health. And so, modern. The age we're living in right now makes that very much a possibility. And that's really what's going to have the greatest effect on the overall health of Black men.
What I find interesting is that, they have this sort of backs of millions, this sort of sweepstakes thing, lottery-based initiative to get people vaccinated. They're going to compensate them with millions of dollars potentially, through this lottery-based system. But I don't see the same thing going on for cancer and cancer awareness in terms of getting as many men screened, and especially in this community, under those same conditions.
To be really honest, Mike, there just really hasn't really been their interest in truly dealing with Black male health issues again, and it becomes this ancillary issue topic. It's just something that gets discussed in passing. In general, female health issues tend to take precedent over male health issues, but specifically for Black men, that's even more true. And again, lots of folks, lots of researchers, they come in. I had a mentor when I was an undergrad. He called them helicopter researchers. They would come in, do the research, get the data they needed, come in early in the morning, out before the end of the day. And you don't see them. And again, the medical system does have a history of doing that. I would be very dishonest if I didn't say that wasn't true. But however, these issues have to be solved by Black men. It's clear that these issues are not going to get solved by anybody other than Black men. The question becomes whether or not Black men are going to stop being apathetic and truly have the courage to really push their sons into these fields. Black people and Black men specifically are never going to get anything that represents health equity or the standard of care if they're not going to do it themselves. If you're not going to invest in developing the institutions that can do the research, invest in the institutions that can treat Black men and treat them with some dignity. And so, yeah, it's such a multifactorial problem that it would take a number of issues. Obviously, money is probably one of the big issues here. Funding is a big issue. Again, cancer research is a multi-billion-dollar business. Okay, lots of postdocs, lots of researchers and physicians make a career off of cancer research alone. This is big business here. But big business shouldn't have to be something where Black men should have to sacrifice their dignity and their self-respect or even their trust in the system to get adequate health care.
Any last thoughts before we close out?
No, I think I said everything I needed to say. No, I appreciate you giving me this time to really say this, because this is something that's been really kind of near and dear to me for a long time. And obviously not just because of my own personal experiences having dealt with prostate cancer within my family, but because this was something that it just kind of fell into my lap in my undergrad years, and I never realized this was such a major issue until I really started to delve into this and started doing the research and stuff like that. So thank you for having me.
Like, share, and subscribe. Make sure you follow us on Twitter as well at brothers_podcast.